What comes into your head when you hear the word Kawasaki? A motorcycle, right? That is very common in most Americans, especially those who do not have kids. When I hear Kawasaki, I automatically think of the heart disease Kawasaki, which is the number one heart disease in toddlers and infants. While it is unknown by so many, it isn't fatal if it is caught on time, but can be if the symptoms are not brought to a physician's attention immediately. To start off, Kawasaki disease, also known as Kawasaki syndrome, is what the American Heart Association explains as a serious illness characterized by inflammation of the blood vessels to the heart and throughout the body that primarily affect young children and infants. Long-term effects, if not treated, are damage to the heart muscle or the coronary arteries. The electronic article, Kawasaki Disease, A Brief History, also explains that the disease is named after Tomosaku Kawasaki, a Japanese pediatrician who published the first English report of 50 patients with Kawasaki disease, or KD. The cause of KD is unknown, although an agent, like a virus, is suspected. Now that we have a little bit of background on the disease itself, we can get into what Kawasaki disease actually is. As stated previously, Kawasaki disease targets the heart muscle itself and the arteries throughout the body, causing them to swell, and if not treated quick enough, they could burst. To date, there is no specific test for KD. Doctors make a clinical diagnosis based on a collection of symptoms and physical findings. Kids Health, an organization for education on infants and toddler diseases, tells us that the symptoms begin with a very high-grade fever that can last up to 2 weeks, and the symptoms can also consist of severe redness in the eyes, a rash on the stomach, chest, or the genitals, red, dry, cracked lips, swollen tongue with a white coating, and big red bumps, also called the strawberry tongue, sore, irritated throat, swollen palms of the hands and soles of the feet with a purple reddish color. And also they can consist of swollen lymph nodes. There is no cure for Kawasaki disease. However, Heart Kids Australia Incorporated tells us that the treatment for Kawasaki disease is an intravenous gamma globulin, or IVIG, made from donated blood transfusions. Large doses of IVIG will usually stop the fever and other symptoms of Kawasaki disease. Treatment should be administered within 10 days of the onset of fever to minimize heart problems in adolescence or childhood. While Kawasaki disease is an awful thing to experience, I myself know that the American Heart Association and all other organizations save the lives of many, trying to make Kawasaki disease aware of each parent and loved one with or without kids. As a survivor, I try to make sure that everyone I come in contact with is aware of this major heart disease, because I want to hear more survivor stories and hopefully find a cure.